Hello, and here we are in week 4 for module 4, the final week of our open course. We trust that the experience is a productive one for you and one that allows for us to examine and explore this critical issue, priority issue of refugee and migrant health. And as we end this course with our final module, our focus is where do we go from here? Understanding the challenges that we have discussed. What is the way forward? From the perspective of health, we need to monitor the health of refugees and migrants because in order to manage any problem, we must measure it. So measuring the indicators consistently and of standard will inform the best practices towards providing the relevant care that is needed. To support efforts for refugees and migrants, it is critical to include policy and legal framework to allow for enforcement, to accommodate for the service delivery, and of course, for the allocation of resources towards these particular activities. Bearing in mind that refugees and migrants are more susceptible, more vulnerable, and predisposed to disease burdens, health systems must be specifically sensitive to these types of characteristics of migrant and refugee populations. This is not an isolated experience. It's a global event, and countries, regions around the world must get together in partnerships, developing networks in response to the crisis of migrant and refugees. The issue is a global issue. We understand that a significant proportion of the global economy is stressed. We also recognize that a significant proportion of the population is compromised as refugees and migrants. So within the context of a challenging economy and the increasing human crisis of migrants and refugees, this is a delicate balance that we must strike. The strategy is fourfold. If we can promote rights of migrants and refugees, these rights include rights for social complements, rights to be able to access and engage in social experiences at their host countries. That rights will extend into education, to job opportunities, and indeed healthcare, not to mention living and working conditions as well. The avoidance of disparities in health will reduce the inequity both in healthcare service delivery as well as in health and disease burden outcomes. Once we can include social coherence and reduce disparities, that can also reduce the excesses of morbidity and mortality that is experienced among refugee and migrant groups. Understanding that the migration process is a very adversarial process, reducing the negative impacts of the travel, of the movement of people, can also reduce the health burdens, because the very challenge in relocation can be a main source of illness, physical illness, injuries, infectious diseases, and stress towards chronic conditions. The plan, therefore, is to establish monitoring of migrant and refugee health, develop information systems to collect relevant data, assess and analyze this data, and respond to this data through the development of sensitive health systems towards migrants and refugees. Fill the gaps. If post-traumatic stress is a significant burden for refugee and migrant groups, then mental health systems must be strengthened towards meeting and responding to those mental health challenges as well. The healthcare workforce must also be trained and sensitive to the burdens of migrant and refugee groups, recognizing that there are differences in social, gender, cultural sensitivities that the society as a whole and healthcare workers must also respect and acknowledge as well. If, for example, some of your migrant refugee groups include women, children, of particular religious backgrounds, we have to also bear in mind that their value systems have particular belief systems in terms of how they communicate, how they interact as well. We have to acknowledge and be sensitive to these variations. The policy and legal framework must be revised and established. Strategies must be incorporated to be enforced, to be activated towards assurance of service delivery towards these groups, and consider the impact of these policies towards meeting the specific objectives of reducing the health and disease burdens of migrant and refugee groups. And of course, all of this can only be achieved through partnerships, governmental organizations, community-based social groups, international aid agencies, organizations from both countries of origin and the host country. To monitor the health of migrants and refugees, we must standardize their data. Standardizing in terms of recognizing that there is specific types of refugee health information that we need, because this data will inform the policies, the legislation, the health services that is required. So information that is sensitive to refugee and migrant groups is needed towards catering for their specific needs. Some of the demographic challenges we face is with movements of people. Demography eventually becomes an evolving experience. Number of people in the population changes. The gender distribution, the age distribution changes because it's a constantly mobile population. So in fact, monitoring this population will be, in fact, a difficult proposition. But if we do have some information about the country of their origin or birth, plus their last known residence or their transit period, as well as the nature of their migratory process, whether it was through land, which countries or regions they traversed, through sea, or even through air sometimes. What was the duration of their residence throughout these different phases of their relocation? What are the social determinants of their health that we discussed previously? And these can be incorporated into tools of population group census, surveys, information gathering at the point of care. The legal framework should enable the extension of social protective services towards these groups. The implementation of these policies is to promote access, availability, and equity of healthcare services as well as other necessary services to enable the settling and relocation of these displaced population groups. As is the case for any law or legislation, there must be respect for the practices, beliefs, values of these particular groups. it does require for the adaptation of various international standards, all geared towards the protection of migrants and refugees. In terms of access to health services, it depends on the capacity, the resource level of the host or destination country. There may be minimum baskets of services that can be afforded to the refugee migrant groups to span even towards universal access to healthcare. But of course, this depends on the socioeconomic conditions of the host country. Awareness of the diseases and the burdens will also determine what type of health services is required. Example will be migrants from sub-Saharan Africa will have high prevalence of HIV and AIDS, which requires for testing, counseling, and treatment management systems, as well as follow-up to ensure maintenance of the management of these disease burdens. These sensitive systems for refugees and migrants must be enhanced through capacity for the workforce to address these changes. Continued professional development of your healthcare professionals towards understanding these limitations, these differences in migrant and refugee groups is important towards delivering the most equitable care available. The comprehensive and coordinated services must be financially sustainable, no doubt. A lot of funding is required for these services. The sensitive system towards migrants and refugees should eventually bridge the gap where the morbidity and the mortality outcomes of migrants and refugees are generally elevated when compared to the general population of the host country. But eventually, the idea is to reduce that gap to the point where migrants and refugees are sharing similar types of observations of health status when compared to the general population. This requires for an understanding of the health burdens, the cultural variations, breaking barriers such as language, and recognizing the fact that the migration process does require, for at least initially, some elevated, enhanced, and increased response from healthcare professionals. The partnerships and networks that is needed is to accommodate for the displaced populations to be relocated across different sectors of the host country society, recognizing that whether it's large cities or rural communities, through cooperation, these individuals can be incorporated into society. This, however, is a global issue, as we discussed, and there is a conversation, planning, and strategic approaches that is required from a global context. The issues are cross-cutting, as the relocation of people brings issues from their origin towards their host. Harmonizing this experience with the native general population is also required through partnerships with civil and private sector involvement within the host country. There is a difference, but the opportunity is there for us to bridge this divide for migrants and refugees. So this brings us to the end of Module 4 and Week 4. And as we reflect on the course experience, think about our own experiences. Think about our family experiences. Invariably, we will identify with the fact that our previous generations would have relocated from somewhere. And we find ourselves as products, outcomes of migrants or refugees. This is a human issue, requires for a humanistic response, and building awareness, understanding the challenges, and developing a path forward towards health and well-being across all population groups is essential. There's an old adage that the strength of a chain is only as strong as its weakest link. As refugees and migrants are now part of our societies, the strength of our society will also depend on the strength of our migrant and refugee communities as well. Do enjoy the remainder of week 4 as we conclude with our seminar presentation, and we look forward to sharing with you a course conclusion session also. So we will meet once again at the very end of the course, and do ensure that you complete the assignments, the assessments, and feel free, as always, to contact us should you have any queries along the way. Goodbye for now. I will see you at the very end of the course.